Hi, welcome to the discussion of cardiology, the study of the heart. This is Dr. Jaitly. I'll be talking to you very briefly the fundamentals and basics of high blood pressure or hypertension. Like I mentioned at a different presentation earlier that you may have reviewed or not reviewed, but just to let you know, the normal blood pressure is 120/80 and it's measured in millimeters of mercury. Just like we have an atmospheric pressure, just like we have a pressure through the faucets in the sink of your kitchen or in the bathroom through which the water flows at a reasonable pressure so you can fill up your glass of water or your tumbler, etc. So similarly, we have miles and miles of vessels going around your body from head to toe, and the heart is helping circulate the blood. So heart, remember, is a circulating pump. So it's tirelessly working and constantly sending blood around your body. So when it sends blood around your body, it traverses through these vessels. Now, when it begins to travel, the pressure is 120/80. But somewhere down the line, as we grow older or the arteries harden past the age of 40, 45, 50, that's where the hardening of the arteries begin. There are tiny little sludge-like patterns or some blockages that develop here. And as the blockages get more and more intense, over a period of time, like here shown very intense, the amount of blood that can travel through is lessened, but the pressure is higher because the orifice is smaller through which the blood is traveling. Here you have a wide open orifice where the blood can freely travel at a pressure 120/80. But as we get older, I'm showing you in the other half of this diagram, as it grows, as we get older, these vessels, they get narrower, and therefore the pressures are depicted as multiple arrows as higher. The pressure could be 180/110. You can pick a number of 200/120. Now these are alarmingly high pressures that develop because of narrowing of the vessels or hardening of the arteries as seen in this right half of the diagram. The left half of the diagram shows there are no obstructions, and therefore the lumen is wide open and pressure is normal, obviously. So just a reminder here, the hardening of the arteries are a precursor for a high blood pressure, and we'll delve on the facts, why do the arteries harden, etc. on our future presentations, and I'll be discussing that in the next steps. But just so that you remember that it is very, very important that we realize that normal pressures exist when you have normal flow and normal lumens of the arteries or vessels, but the pressures are higher when you have obstructions within the arterial system, and the pressures are alarmingly high. That makes the person more prone for stroke, kidney damage, heart damage, and or other vital organ damages, etc. Now, what are the causes, other causes of high blood pressure or narrowing of the arteries or hardening of the arteries? We'll discuss those in my subsequent presentations. Thank you for your attention, and this is Dr. Jaitly again. Looking forward to seeing you again in my next presentations. Bye.